Patient MB is a 39-year-old single male who lives at home with his mother. He is currently unemployed. Patient presents with a known PMH of ETOH cirrhosis, hypertension, edema, and obesity who presented to the UKED at the request of his home health nurse secondary to progressing lower extremity wounds. He states that over the past 2 to 3 weeks, the wounds have developed severe eschar and are now draining a purulent material. The patient states that over the past week, he has developed a 10 out of 10 pain at rest and that he is no longer able to ambulate or perform ADLs. It is for this reason that his home health nurse became concerned and decided to transfer him to the emergency department for evaluation. In the ED, the patient was found to be tachycardic on arrival, and the patient noted a subjective fever in the outpatient setting of 100. CBC and BMP were then collected and found to be abnormal with a white blood cell count of 20 and a left shift with neutrophils of 15.6. Potassium was also elevated at 5.2 and a urinalysis and pain of a likely urinary tract infection. With these findings, the patient was started on IV vancomycin and Zosyn. The patient was deemed stable and transferred to the UK Good Samaritan Hospital for further care. The patient's past medical history consists of alcohol abuse, hepatic encephalopathy, obesity, anemia, gallop, fungemia, suicide attempt secondary to Xanax overdose in 2007, prior tobacco use, hypertension, polysubstance abuse, and which he has been sober for 6 months. His past surgical history, he had a tonsillectomy. The current medications he is taking are rifaximin at 550 milligrams oral tablet 2 times a day, zinc oxide 40% topical ointment, furosemide 20 milligrams, spironolactone 100 milligram tablet, albuterol, acetaminophen 500 milligram tablet every 6 hours, fluoxetine 20 milligram capsule, gabapentin 100 milligram capsule 3 times a day, melatonin 3 milligram tablet, ondansetron 4 milligram tablet every 6 hours, Vistaril 25 milligram capsule, and pantoprazole 40 milligrams. The patient's allergies, the patient is allergic to Tylenol, cold, and sinus medication, and he gets hives and itching and rash when he takes this medication. For family history, his mother and father were reviewed and none were contributory to his hospitalization. The patient is receiving vancomycin 750 milligrams IV piggyback. The classification of this medication is an antibiotic. The mode of action of this medication inhibits bacterial cell wall synthesis, and it blocks glycopeptides. The patient responds to the medication well. The patient is taking this medication for a bacterial infection. The side effects of vancomycin include cardiac arrest, vascular collapse, hypotension, peripheral edema. For these side effects, I would keep the patient on a heart monitor and assess the patient's blood pressure and vitals daily. Other side effects include wheezing, dyspnea, and for these side effects, I would assess patient's lung sounds every shift. Other side effects include nephrotoxicity, and which I would monitor the patient's I's and O's, report hematuria, oliguria, BUN, and creatinine. Nursing considerations for this drug include assessing the white blood count, urine, stools, sputum, characteristics of wound throughout treatment, and obtain a culture and sensitivity before starting the treatment.